Hello everyone, I am Dr. Neha Chauhan. I am a consultant plastic surgeon with Aster Hospital. Plastic surgery is the most creative of all super specialities of medicine as it combines art along with science for the betterment of fellow human beings. You would be happy to know that plastic surgery has origins in India in 6th century BC. The first principles of plastic surgery, which are well documented in the history, are laid by Sushruta, who was an Indian, and he wrote a book called as Sushruta Samhita. That book has techniques and even instrumentation regarding plastic surgery. So we were doing plastic surgery since a very long time, since 6th century BC. Plastic surgery remains a lesser known super speciality of medicine because it is not defined by a single organ system. As a result of which, general public has a lot of myths and misconceptions regarding this specialty. The first and foremost myth around plastic surgery is that plastic surgeons may be using something artificial or plastic in their surgeries, hence it is called as plastic surgery. But this is far from truth. Plastic surgery is named after a Greek word, plastikos, which means to mold. Since we are able to mold the tissues to give the desired form and function, plastic surgery is so called. The second common myth is that plastic surgery and cosmetic surgery are same. I would like to tell that plastic surgery is a very vast super specialty which includes management of burns, reconstruction of trauma, reconstruction of cancer, cleft and craniofacial surgeries, microsurgeries, limb replants and transplants, and also aesthetic surgeries. Thus, aesthetic surgeries or cosmetic surgeries form a very small subset of plastic surgery spectrum. The third myth is that people think that plastic surgery, especially the cosmetic surgery part, can transform them into something very different. They can become some kind of a celebrity, or they can match their appearances with some celebrity if they get their aesthetic surgery done. This is not the truth, neither this is the goal. The goal of aesthetic surgeries is to improve your appearance from what you are at present to make it more proportionate and more aesthetically pleasing. The goal is not to make you into something else. The changes are made very subtly to improve your appearance. Another popular myth around plastic surgery is that plastic surgery means it will not leave any scar. This is not possible. Plastic surgeons basically give you scars which are very fine, very meticulously planned, and mostly placed in very hidden areas so that they become inconspicuous over a period of time. We also give you a very strict post-surgery protocol to follow so that the scars are made minimal. But scars are still there. There is no surgery which can be scarless. So now I'll be talking to you about the factors which determine whether a candidate is good for plastic surgery or not. Just like any other specialty, we also have choices of candidates who are considered to be ideal candidates for cosmetic surgery especially. The first and foremost important point would be that the patient is self-motivated for aesthetic surgeries or cosmetic surgeries. Self-motivation means that I want to look good, that is the reason I get a plastic surgery done. Not because my significant other or my peers or my parents are telling me that I should get a surgery done. These are the patients who would have good satisfaction if they are self-motivated. If patients are motivated by somebody else or have some other mottos behind getting the surgery done, they would never be happy patients. Second important thing is to have realistic expectations. Patients who have realistic expectations from their surgeries would benefit from plastic surgeries. Having an unrealistic expectation that we can transform you into somebody else would lead to disappointments at a later stage. The third important thing is patients who are having clarity as to what they want from plastic surgery, they are good candidates. So a patient who comes to me and tells me, "Doctor, make my nose better," those patients would not be a good candidate for plastic surgery. Instead, a patient who comes to me and tells me that I don't like the tip of the nose, I don't like the dorsum of my nose, those are the candidates who give me a very clear idea as to what they are looking for, and they help me give better results to them. The fourth important thing is that plastic surgery requires long follow-ups. So patients who are ready to follow up long with the doctor and they are able to follow the instructions in the post-operative period are good candidates for plastic surgery. So once you have come to know that you are a good candidate for cosmetic surgery, where do you go for your cosmetic surgery? While deciding where to opt for your cosmetic surgeries, the first important thing is to know that your doctor is well qualified to do plastic surgeries. As I have mentioned earlier, the doctor must have the degrees of MBBS, MS in general surgery, and then MCH or DNB in plastic surgery. Then only he is authorized to perform cosmetic surgeries or plastic surgeries only. So you have to be very clear that a doctor has all these qualifications. Second important thing is you should have a good vibe with the doctor. A doctor, when you meet a doctor, you should find that you are on the same page, you are able to clear all your doubts with the doctor, and you are able to have a very fair judgment of what are the pros and the cons of a surgery. If a doctor is able to explain those things to you and gives you enough time to have your decisions, then you would be having good results. Third important thing is to conduct plastic surgeries in safe environment. It is important to get plastic surgeries done in environments which are safe. It may be a little bit more costly, but cost is a secondary factor, patient safety comes first. So avoid getting a surgery done in very small kind of setups which are not good to handle the complications. Cosmetic surgeries are the surgeries which are done by patients for the self-improvement. These patients usually do not have any kind of disease. The only desire is to look better than what they are. 87% of the cosmetic surgeries are underwent by women and the rest 13% by men. The most common procedures which women undergo in my practice are breast augmentation, breast reduction, liposuction, abdominoplasties, rhinoplasties, and female genital cosmetic surgery. Amongst men, the most popular surgeries remain rhinoplasties, hair transplant, gynecomastia surgery, surgery for liposuction, and abdominoplasties. To conclude today's session, I would like to give you the most important takeaway message from today's talk. The most important message would be that for your aesthetic surgeries or any other plastic surgery, you must opt for a qualified plastic surgeon. Thank you.